Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jennifer Blanchette. Today's episode features coverage of the 2020 Conference on Retroviruses and Opportunistic Infections, held virtually from Boston, Massachusetts in March 2020. During this podcast, Dr. Monica Gandhi from San Francisco will discuss new data presented at CROI 2020 on two very important aspects of HIV patient care: weight gain and metabolic changes during antiretroviral therapy, and the latest information on HIV prevention strategies. For more information on Dr. Gandhi and for a link to additional online CCO coverage of CROI 2020, please visit the show notes for this episode. Now let's get started and hear what Dr. Gandhi has to say about these important studies.
CROI 2020, held virtually, really revealed some insights on important clinical questions about recent data looking at weight gain with different antiretrovirals. Really, last year's CROI in 2019 showed us a lot of data on the impact of integrase inhibitors, impact of tenofovir alafenamide, TAF on weight gain, and really this year's CROI in 2020 started to get deep on looking at some of the mechanisms and also gave us a few more insights on metabolic complications of such weight gain. So the first abstract I want to start with was an abstract from NA Accord, which was abstract 668. And this was a very large study that looked at INSTI switch or integrase inhibitor switch in treatment experienced patients and also measured the impact on weight gain following up on data from last year. The source population for this study was 17 contributing cohorts from NA Accord. And very importantly, the study population were those with virologic suppression, because we don't want viremia to be contributing to or confounding our findings. And in this study of 870 patients in NA Accord who met the virologic suppression criteria, 83% were male, 59% were white, the median age was 50 years, the median BMI was 26 kilograms per meter cubed. And the question of this study was, what was the impact of switch from an NNRTI-based regimen to an integrase-based regimen, or from a PI-based regimen to an INSTI-based regimen? What was the impact of switch on weight gain? And what this study showed is that over 2 years, there was greater weight gain with a switch from an NNRTI to integrase inhibitor, specifically dolutegravir, but not from a switch from NNRTIs to protease inhibitors. So importantly, the weight gain was entirely driven by integrase inhibitors, and specifically, it was driven by dolutegravir. Raltegravir and elvitegravir were the only two integrase inhibitors looked at in this study, and they didn't drive the weight gain. And the average weight gain was 1.73 kilograms of weight gain per year, and that went out to 2 years, the analysis. So that really confirms what we've been seeing before, but this is a very large study of dolutegravir and weight gain. Importantly, bictegravir could not be looked at because of the timing of this analysis and when bictegravir came out. Then another important study in weight gain from CROI 2020 looked at the ADVANCE study. And in the ADVANCE study, the specific question that was being looked at is, what was the impact on cardiovascular risk or diabetes risk in ADVANCE with the weight gain changes that we had already seen as published in the New England Journal? So this was specifically abstract 81. And the question was, again, the ADVANCE study, which really looks at three major arms among treatment-naive patients in Africa. One arm was tenofovir alafenamide and FTC with dolutegravir. The second was tenofovir disoproxil fumarate plus FTC with dolutegravir. And the third arm was TDF, FTC, and efavirenz. And remember that the main findings of this had shown that we had excessive weight gain, especially among women. We already knew this on the TAF, FTC, dolutegravir arm. So the specific question of abstract 81 was looking at diabetes and cardiovascular risk complications. And really, what this study showed is that over 96 weeks, there was just a very small increase in cardiovascular risk by the Framingham study in the pooled dolutegravir arms compared to the efavirenz arm. And it was very, very small, and that's probably because there is a very short period of time for this. However, there was a small incident risk of metabolic syndrome at 96 weeks, again with the TAF, FTC, and dolutegravir arm. So specifically, the findings then of the advanced study is very small increase in metabolic syndrome risks with the dolutegravir TAF arm, very small increase in diabetes risk with the dolutegravir TAF arm, and not a major increase in cardiovascular risk, but it's probably because we only had a short period of time. The median age of the cohort was 32 years, and we really need to look over longer periods of time. So this analysis does not account for ongoing weight gain beyond the 96 weeks that were followed in the advanced study, and more study is definitely needed. There was also another abstract, which was abstract 680, that also looked at the question of diabetes and the impact of diabetes with the weight gain seen with integrase inhibitors. And this was also done in the NA Accord study. And this was a study that specifically looked at ART-naive adults over 18 years old who initiated ARVs from 2007 to 2016 in the NA Accord study. And so the specific question of this was, what was the incidence of diabetes in the NA Accord study over that period of time when people were switching to integrase inhibitors? It was a very large study, 22,976 ART-naive adults. And the specific study, again, was looking at the incidence diabetes result. Specifically, what this study showed is that integrase inhibitors and protease inhibitors, both grouped in aggregate, and also separated out by integrase inhibitors and protease inhibitors, were both associated with incidence diabetes. Importantly, among the INSTI group, only raltegravir was associated with incidence diabetes. Remember, raltegravir has been out since 2008. We do have longer periods of follow-up in the NA Accord study with raltegravir than we do with elvitegravir or dolutegravir. And importantly, the incidence diabetes risk was only partially mediated by weight gain, suggesting that there may be other mechanisms for incidence diabetes other than the weight gain with integrase inhibitors and even with protease inhibitors. And then the final group of abstracts that I want to quickly tell you about from CROI 2020 that are relevant to weight gain specifically looked at the mechanisms that could be related to weight gain. There are three specific abstracts that I want to tell you about. The first one was abstract 772, and that looked at postpartum weight gain with dolutegravir and efavirenz. That abstract really was looking at changes in women who were postpartum and what happened with their weight if they were either on efavirenz or dolutegravir. And interestingly, what this study suggested is it isn't weight gain with dolutegravir that could be associated with postpartum weight gain, but weight loss with efavirenz that could make dolutegravir look relatively like it's associated with weight gain. So we need more on that, but it could be that efavirenz is associated with promoting weight loss as seen in the postpartum study. The second study that I want to tell you about that has to do with mechanism is abstract number 82 from CROI 2020. And this looked at, specifically in the advanced study, the impact of the CYP2B6 genotype and weight gain or weight loss specifically with efavirenz. So what I mean by that is the cytochrome P450 2B6 function is a polymorphism in a gene, and loss of function of the CYP2B6 polymorphism is associated with higher efavirenz concentrations. And it looks like in this population, in the advanced study in Africa, there was about 30% extensive metabolizers of efavirenz, about 43% moderate metabolizers of efavirenz, and 27% slow metabolizers, where you'd have higher efavirenz concentrations. And it was that group with higher efavirenz concentrations, as predicted by the CYP2B6 genotype, that seemed to have more weight loss. So that, again, is suggesting that efavirenz concentrations may be associated with weight loss, that it's really the efavirenz that's driving the weight loss when we compare efavirenz and dolutegravir. And then the final study among this group of abstracts that looked at mechanism was really the study 667. And that study at CROI looked at really changes in weight, metabolic rate, and caloric intake. So specifically what this did was look at a question of, is it that we're changing caloric intake? Is that's really what's happening with weight gain among people living with HIV? And really, it's a very small study, but it doesn't look like the changes in weight gain that we're seeing with the integrase inhibitors, at least in this small study of HIV, people living with HIV, didn't seem to be related to caloric intake. So that really gives us a clue that there may be changes in metabolic rate, something metabolically going on with the integrase inhibitors that's leading to these changes in weight gain with integrase inhibitors. So a lot of data from CROI relevant to weight gain. It was summarized beautifully in a session at the end of CROI on the Wednesday afternoon session by Jordan Lake, who summarized a lot of the data related to weight gain over the last couple of years with integrase inhibitors, including the recent data from CROI 2020. So I would encourage everyone to watch her webcast on that very important summary statement. Otherwise, really interesting data on, again, showing us again that integrase inhibitors, specifically dolutegravir, is associated with weight gain. We don't have enough data with bictegravir. There may be weight loss associated with efavirenz, and that we need more mechanistic questions on. And the third major finding is that diabetes seems to be an increased complication, both with integrase inhibitors and even independent of integrase inhibitors, and even with PIs over time in the setting of chronic HIV treatment. Okay, I now want to switch over and tell you a little bit about the PrEP studies that were at CROI. And really what I'll refer you to is an oral session that a lot of the interesting PrEP studies came out of. This oral PrEP session is summarized in abstracts 87 through 94 at CROI 2020. And to just briefly tell you some of the highlights of that session, abstract 87 really looked at a macaque study, and the specific question was looking at whether bictegravir FTC TAF could serve as post-exposure prophylaxis among individuals living with HIV. This is, again, a purely macaque study, and this was not pre-exposure prophylaxis, but PEP, or post-exposure prophylaxis. And these macaques had rectal viral exposure, and then they were given FTC TAF and bictegravir after an exposure, simulated exposure, compared to FTC and TAF alone. And what this found is that it did look like FTC TAF and bictegravir had benefits in terms of providing protection for post-exposure prophylaxis, but further study, of course, is needed, especially in human models. Another macaque study looked at a very interesting vaginal insert that was actually composed of TAF and elvitegravir in macaques. This is abstract 88. Again, we need human data, but it does look like this vaginal insert of TAF and elvitegravir may have activity in macaques against vaginal exposure. The third study I want to highlight is a study which is abstract 91, which was looking at a real-time urine-based test that really can show us tenofovir levels in real time. So this test, the problem with self-reported adherence to PrEP, either with TDF or tenofovir alafenamide, is that self-report can often be inflated and is limited. And so this is a group that showed that there is now a urine test that if you dip the urine or just put a few drops of urine on the test, it can show you yes, no, if tenofovir has been consumed in the last 24 hours. That can be very helpful for routine clinical settings to have an objective measure of adherence in the field. And then finally, I did want to just tell you about study 92, which is really the Discover trial. And this is showing us the longer term safety of of FTAF, or tenofovir alafenamide emtricitabine, compared to FTC-TDF for people who are at risk for HIV. The DISCOVER trial was shown to us last year at CROI in 2019 at 48 weeks, and this is the 96-week results, looking at longer-term safety implications for FTAF versus FTDF. This was, again, a study that enrolled mainly white men, 84%. They were MSM, mainly, very few percentage of transgender women. And the study design was comparing FTAF to TDF FTC-based PrEP. The efficacy at 96 weeks remained similar in the two regimens for preventing HIV infection among MSM on the two different PrEP regimens. In terms of safety, as we saw at 48 weeks, there were more significant declines in bone mineral density in those on TDF FTC compared to FTAF at 96 weeks, in terms of significant bone mineral density changes, more of those greater than 3% in the FTAF arm. But on the other hand, weight gain continued to be shown as more severe in those in the FTAF arm compared to those on TDF. So the weight gain was 0.5 kilograms on those on TDF FTC over the 96 weeks, compared to 1.7 kilograms on those on the TAF FTC arm over 96 weeks, which does add to our data on weight gain with TAF. So really, these are the main PrEP trials that I wanted to tell you about, and the weight gain trials I wanted to tell you about at CROI 2020. It's a very exciting meeting, though it was virtual, and encourage you to check out these oral abstract sessions. And thank you very much for your attention.
Thank you very much, Dr. Gandhi, and thanks to listeners for joining in. As a reminder, to view the full CROI 2020 conference coverage program on the Clinical Care Options website, click on the link in the show notes. Thank you.